Hi to all the super women and men. Welcome to the TeamCJColas YouTube channel. My name is CJ and I am a stage 3 uterine cancer survivor. I created this video to bring awareness to uterine cancer because it is the most diagnosed gynecological cancer in the United States according to the CDC. So with that being said, when was the last time you heard about uterine cancer? So I created this video because someone you love or you may be living with uterine cancer and not even know it. So let's get started. In this video, you will learn about what uterine cancer is, how it can affect you, the risk factors, the symptoms of uterine cancer, how it can spread throughout your body, and how you can be living with it, like I mentioned, and not even know that you have it, and how early detection can save your life. I wrote down some notes on uterine cancer and some key points that's very important that I would like to speak about. So if I'm looking down, that's because I'm making sure I don't miss anything. Also, I don't want to make this video too lengthy. I just want to get to the main things about it and then create another video to discuss those key points as well. First, what is uterine cancer? As I mentioned, it's a type of cancer that begins in the uterus and it can spread anywhere outside of your body, anywhere outside of your uterus, to say. For example, it can spread to your lungs, to your liver, to your brain. When I was diagnosed with stage 3 and it had already spread to my lungs. So there are 4 stages of uterine cancer, and I don't want to go through each stages, but I will create another video just to talk about the different stages of uterine cancer and the treatments for them. Also, who gets uterine cancer? Most women diagnosed with uterine cancer are over 50 years old, but it does not exclude you from being diagnosed if you are under 50. I was only 35 years old when I was diagnosed with uterine cancer, and that was 3 years ago. So you could be living with uterine cancer at 25 years old. I met a woman who was diagnosed when she was about 22 years old, and she's about 30 years old now. And that interrupted her from being a mother, because once you are diagnosed, and depending on the stages, you could have your uterus removed, which would interrupt motherhood for you. So those are some important information that you need to know, and how you can always be mindful if you experience something that's abnormal to get your to get medical attention, because it may be more serious than you think. Also, risk factors and symptoms of uterine cancer. Some of the risk factors are being extremely overweight. Also, if you had an early menstrual cycle, like at an early age, as far as maybe, I know some people had it at 10 years old, could be earlier maybe, that can be a risk factor. But I am not a medical doctor or medical professional, so I can't say just because you had your menstrual cycle at an early age and that can happen to you. It's just some of the facts and risk factors that could lead to uterine cancer. Also, if you have family history of uterine cancer, there could be a possibility as well. Some of the symptoms of uterine cancer are having a heavy vaginal bleeding, bleeding in between your menstrual cycle, blood clots that can be very heavy, also pain in your abdomen, pain during menstrual cycle. Those are some of the symptoms that you may experience from uterine cancer. When I was diagnosed, I wasn't in pain at all. I never experienced pain, but I did have a menstrual cycle that lasted between April and August. I started experiencing symptoms in April, and I didn't ignore it. I spoke with my doctor about it, and it went from month to month, keep giving me information. I was actually misdiagnosed the first time, actually the first few times. And I was told that I had fibroids, which led to other things, and eventually it was uterine cancer. And by the time I learned I had uterine cancer, it had already spread to my lungs. So this is something I will create another video to talk about, and how I learned I had it, my journey with uterine cancer, and how, you know, you may experience something totally different than I did. Every one is different and may experience something different. Also, keep in mind how uterine cancer can be treated. Again, depending on your stage level, some people may just have your uterus removed and you'll be fine. Some may have to remove your uterus, go through chemo and radiation, like I did, and have to go through extreme treatment to survive it. So the earlier that you are diagnosed, the better your survival rate is, the greater it is. Also, just to keep in mind, uterine cancer is more common in Caucasian women. However, it is more deadly for African Americans. I don't want to go into too much details about that. That's something I would love to create another video to discuss. But it is for a fact that it is more likely to kill African American. And one reason I will give you, because of lack of awareness, it is one reason I can tell you. So again, I will create more videos to discuss different things about uterine cancer, how it's affecting African Americans, how more Caucasian women are more likely to get it, how uterine cancer can spread throughout your body, and the different stages of uterine cancer. There's so much I can tell you about uterine cancer that we don't hear about or know about, and it can take all day, all night. So I'll break them down into different videos just so that they can be short. I don't want this video to just be 1 hour long. So I'll definitely do that. And how could you be living with uterine cancer and not even know it? This is another thing I would like to create. Yes, you can be living with it and not even know it, because you may not experience serious symptoms that's concerning to you. You may feel like, oh, this is just a light menstrual cycle or light period. It'll go away. Or your body's used to having heavy menstrual cycle and you think, oh, this time is just an extra month or something that you may ignore. But something serious may be happening internally and you have no idea. So always be mindful if you're not used to something. Another example is having abnormal pain, especially during intercourse, having pain in your abdomen. This is something that's abnormal. So please seek medical attention about it. I am not a medical professional and I'm not a doctor, so there's no way I can give you medical information in detail about it, but just to give you some of the examples that I've experienced, some things I've learned, and other people that I come across with uterine cancer since I started this journey. I actually created a support group. It's a private support group. It's online. So if you or someone you know, someone you love may be going through uterine cancer and would love support, please subscribe to this YouTube channel. Send me a message on my website. It's www.TeamCJColas.com. Also send me a DM on Instagram at TeamCJColas.com. Well, not .com, but TeamCJColas. Every social media outlet, it's TeamCJColas, so it's really easy to find me. Here's the spelling here. Also, you'll learn about how or when uterine cancer is celebrated, or what month they bring awareness to uterine cancer. It is in the month of September, and their ribbon colors are peach. It's not pink, it's just peach. So these are some of the things that we don't hear much about or learn about. And I want to talk about fighting cancer, and I'll talk about my journey and with fighting cancer. All I can tell you now, you need a support group. You need to have a support around you throughout the journey. You can't do it alone. There's no way to do it alone. Although there are times you may feel alone, even in when you have 100 people around you, but it's just kind of like mental. It's a mental thing that you feel alone, and how uterine cancer can affect you physically, mentally, emotionally. Like those things I will talk about in another video, because again, I don't want to take too much time on this first video that I created about uterine cancer, but there is so much to learn about it and so much we can discuss. Okay. Again, early detection can save your life. With that being said, the earlier, the greater your risk of, your greater your survival rate. If you are diagnosed at stage 1, the greater it is. I know someone who's currently fighting uterine cancer right now. She is about 59 years old and she's going through a hard time. She had breast cancer in the past, and she said that was 30 years ago, and now she has uterine cancer. And I want to create a video to talk about uterine cancer, how, well, not just uterine cancer, just cancer period, how it can mentally affect you. That's something I don't talk about with family or friends, because it's something I've never really, I don't like to discuss, like mental, how you feel, but it affects you. Well, me, I should say, because to sit around and think about the possibilities of you having cancer again, that's something that's very mental and something that's very stressful. It can affect you mentally, like I mentioned. But again, I will create more videos to talk about uterine cancer. And if you have any questions about it, please send me a question on my website at TeamCJColas.com, or Instagram. Follow me on Instagram, Facebook. Send me any message, any questions that you may have. Let me know what you want to know. Let me know what I should talk about, and I'll create more videos. Thank you for watching. Please share. Don't forget to share, comment, like, and subscribe. Thank you, you guys. Love you all.